हेलो गाइस एंड वेलकम बैक टू माय चैनल। आज का चैनल होने वाला है ऑस्की का ओवरव्यू के ऊपर। आई विल बी टेलिंग यू मोर इन डेप्थ लाइक व्हाट ऑल स्टेशंस, नॉट व्हाट ऑल स्टेशंस बट व्हाट ऑल इंक्लूड्स अंडर ऑस्की. So people who are just preparing, who have just started their OSCE, can refer to this video. It will be really very helpful. So without wasting much time, let's start with the video. OSCE. OSCE is basically it's an UK exam which is mandatory to give like before we get our PIN. OSCE is mandatory for all UK people, like for all UK nurses. Okay, so OSCE contains 10 stations. Now I'll be telling you what all 10 stations are. So first is assessment. Okay, first is API, which stands for assessment. Second is planning, third is implementation, and fourth is evaluation. What does assessment mean? So basically in assessment we have got 10 stations, okay, in 10 topics to study. So if you want assessment full video, like under assessment what all things are there, for that also I'm ready to make a video, but now I'll be just giving you an overview structure. So in assessment basically there are 10 topics, okay. So suppose for example if you get a topic as Alzheimer for your exam, okay, so if you get a topic of Alzheimer, so assessment you'll be doing on the Alzheimer patient, planning you will be doing on the same Alzheimer patient, implementation on the same Alzheimer patient, evaluation on the same Alzheimer patient. So the topic which you will be getting on your assessment thing, you will be carrying those with, like, you will be continuing with your planning, implementation, evaluation. So assessment, planning, implementation, evaluation is together, it's like a set, okay. So in assessment mostly like 100% only, for 99% I can say, because sometimes examiner, like the actor might not be available at that moment, they can give you a dummy, but mostly like 99% I've asked my friends also, it's always a real actor who will be acting as if they are having the same disease condition which they have mentioned. So whenever we will be getting a paper of assessment, they are not going to mention about the disease condition, okay. You have to find out, like we will be getting it just because somehow in the recent complaints they will be writing it, okay. So not to worry, okay. So that is how we are going to do our assessment. So once assessment is done, planning, there will be no actors, nothing. You will be just given you will be giving they will be giving you a paper and a pen. You just have to write it. 2 care plan, making sure that you write your name, everything, okay. So you have to make 2 care plan according to the condition, okay. So like I just want to give you an example, because somehow we must have learned in our classes, or like classes or YouTube videos we must have watched, right? But be very careful when we are reading the assessment part, okay. If the patient is not having any complaints of pain, just don't write, because we have studied that an Alzheimer patient is going to have pain. Nothing. You have to make your own, like not own, you have to have, like in pneumonia you can say, you should always have 1 care plan ready with you, like for the 10 conditions, 10 care plans, which will be mandatory. Like for Alzheimer's you can say cognitive impairment will be there, so you have to keep one care plan ready. And second, according to the condition, according to the patient condition, or according to the patient, like when you ask the patient is going to tell you for sure, okay. So in CHF you can say patient might have swelling, so according to that you have impaired mobility you can say, but you have to just check, okay. At times be very careful while doing the planning thing, because somehow they write it in the, like in the down part. Sometimes I'm saying sometimes it might be mentioned that patient, suppose in the assessment patient was having pain, but during the planning they will write like in the down, make sure that you read everything, okay. Still write patient has got relief from the pain. Do not write the care plan because in the assessment you have seen that the patient was having pain. No, because in the planning they have already written, because assessment and planning you have some, like you have few minutes, right? For example, in that few minutes patient like got relief from the pain, so do not mention about the pain because already they have written. So apart from pain you can write anything. So be very vigilant while doing the planning, because read what they have written. Okay, so according to that you can frame, like you can make 2 care plans. My suggestion would be, in those 10, for every disease condition, keep 1 care plan ready, which will be very, like, it is mandatory that patient will be having. Just keep all those ready, and some basic care plans like ineffective breathing, pain. And like, if you want a separate video for planning, that also I'll be making, because this video will be very long otherwise. Okay, so now planning is done. So as I said about the assessment, planning, now implementation also you will be getting a real actor. That means you will be giving, like, you have to give the medicine to them. They are not going to eat. They are just going to say that, just assume that I have taken the medicine, but you have to make sure that you get the glass of water. You have to give it to the patient. You have to act as if you are giving it to the real patient, because they are going to have an ID band. They are going to take the tablets on their hand. So once they swallow the tablet, make sure that just to ask, did you swallow the tablets, and then you can just do your implementation work. Okay, so in implementation also you're going to get a real actor. After implementation, last is evaluation. In evaluation there is no actor, it's only you and your examiner. In evaluation it is going to be a SBAR handover. Okay, so according to that you have to give handover. So assessment, whatever topic, like whichever topic we will be getting in the assessment, same we will be continuing with the planning, implementation, evaluation. Okay, the same topic for assessment, planning, implementation, evaluation. So in assessment, basically in API we have 10 topics. If you want depth video, I will be making, like, if I get comments, I'll make sure that I make next video of assessment API thing. So now once that is done, like API is done, we will be starting with the clinical skills. In clinical skills we will be getting 4 topics. Okay, so 4 topics, as I already said. You might be getting, like, 1 prescription you will be getting, non-prescription and silent, and 4th one you can get either of one, like you can either get prescription, non-prescription or silent. Mostly it won't be silent, it will be always prescription or non-prescription. So 1 you will be getting prescription, 2nd you will be getting non-prescription, 3rd you will be getting silent. That is mandatory. 4th one you can get either prescription or else non-prescription. 1 you will get. That means clinical skills 4. Okay, so after clinical skills are done, you will be getting professional values. And professional values, we have 11 topics. Like recently when I gave my Osce, I had 11 topics. Okay, so like my friends, they used to have 10 or 8 topics, but now they have, like, increased the topic. It is now 11. Okay, so 11 professional values, and evidence-based practice 12. So this is all about Osce. As I said, we will be, like, I'll just give you an overview. First, API, that is, among 10 you can get any one. Like 10 topics are there in API. In that 10, any one you can get, and in that one only, like any of the disease, you have to perform assessment, planning, implementation and evaluation. That is done. That is 4 topics. After that you will be having clinical skills. That is 4 clinical skills: prescription, non-prescription, silent skills, and either you can get prescription or non-prescription. Okay, total 8. After that, evidence-based practice and professional values. So in the exams, they can either start from clinical skills first, or they can start with the API. They cannot, like, they are not going to jumble it. Okay, not to worry. Either they'll start API, like assessment, planning, implementation, evaluation, or else they can start clinical skills, professional values and evidence-based practice. During my exam, as my actor was not available for assessment, I had to start with the clinical skills, professional values, evidence-based practice, and after that I started with my assessment, planning, implementation and evaluation. So this is all about Osce. It will take, like, maximum, if we finish our Osce exam, it will take, I can say, 1.5 hours. It all depends on our it all depends on the availability of the actor, and also, like, how fast we are finishing and how many times we are taking the break. It all depends. not to worry, they'll make like after each station they'll give us a break. Like after one clinical station they'll tell us to wait back, like wait outside, we can have water, we can just relax, and after that again they'll call you inside. Okay, so if like I know like previous videos were little bit, like I can understand it was not up to the mark, but this time I made sure that I'm very clear, very concise, no repetition of things. Okay, so if you think that I'm still making, if there is any kind of improvement which I need to make, please comment so that I can improve. That is how I can improve, right? Like I really wanted to make videos. I really want that like people should watch my videos, at least they can get an idea, because when I was giving my OSCE, trust me, I didn't have a single video on YouTube. I used to watch like, but neither of the videos I used to get a feed like I used to watch videos, but always they used to be like it is tough, difficult. But I really want to say it's not at all difficult, it is easy. It's about practice. I know, practice little bit, but be confident. Practice is important, but confident is more important. Okay, but just be confident, just practice and practice, and I'm very sure that all can pass their OSCE. It is not as difficult as we were thinking. Like when I was giving my OSCE, I had so many things on my mind, like because I had watched videos and I have heard from my friends that they didn't pass the OSCE on first attempt, they missed that, they missed that. But the more we think, the more we are going to panic. Okay, so not to worry, I would suggest go and watch some positive videos. I'm not saying watch my videos, but go and watch some positive videos, like people who can motivate you. You can watch any of the videos which can make you comfortable. If you want like me to make any kind of videos or any clinical assessment or like any clinical skills which you want, or any depth video, you can anytime like write it on the comment box so that I can make a video for you all. Any suggestions for me also, I'm ready to improve. And this was all about OSCE overview. I hope that is clear. If you want any depth video, as I said, you can anytime comment. And thank you so much for watching my video. And also I'll be coming live on TikTok, like I can say day after tomorrow, or I'll let you know once I am done with my, I'll share you the TikTok page like below, so there you all can just come if you all want. Like we can have a chit chat, like live session. It would be really very helpful just to have discussion. Okay, so thank you for watching my videos. Keep following, keep giving me suggestions, because it will really help me to like grow, like how to make videos. Like really it will be very helpful, and I'll always take it in a very positive form. So all the best for like all of you, and I hope you pass your OSCE on your first attempt. Thank you.